Hello everyone, we're starting our Let's Talk Health and I am so excited to have, I'll let you introduce yourself, then kind of talk about myself.
Stephanie Cudjoe from Blue Med.
And I'm Marielle Landrom, and I am one of the owners of LG Lifestyle, and we're excited because we are talking about mind, body, and soul, and today we just want to talk about some of the common myths in women's health, right? I know if you're me, sometimes I just go online, Googling, trying to find information, figuring out what's out there. So now we have a doctor who can actually articulate and explain what the questions that we have, right? So let's start off with question number one, or myth number one. Cancer cannot be prevented.
So this is a very, very common misconception. A lot of folks think that if it's either in their genes or if my mom and dad had it, then I'm going to have it. And they kind of resign themselves that one day they're going to have some type of cancer, whether it be colon cancer, lung cancer, breast cancer, ovarian, you name it. You know, cancer is just this one big enigma that folks don't want to deal with, and they think that they can't necessarily deal with it. But that is a huge myth. There are a lot of things that we are learning in the last 10, 20 years, in particular that a lot of cancers are environment and lifestyle driven. So for example, the biggest one, the best example I can give you is lung cancer, for example. Everyone knows that if you smoke, your risk of lung cancer increases. Of some particular lung cancers will increase. But also we know that obesity increases breast cancer risk. We know that obesity also increases colon cancer risk. So more and more data is coming out letting us know that there are things that we can do, like keeping a healthy weight, eating a healthy lifestyle, eating a plant-based lifestyle, a plant-based diet that can really improve the risk that we have with our cells over replicating and forming cancers.
Well, that's awesome. So for those of you who think it is hereditary or you can't do anything about cancer, you definitely can. It's a lifestyle, and like she said, you know, focus on nutrition, working out, and just changing that lifestyle and doing preventative things. Actually going into the doctor and getting your checkups is very key. So thank you for sharing that with us. Number two. All right, so this is a good one. You can't get heart disease until you're old, or you think it mostly affects men.
Yeah, so those are two connected and both equally false ideas. Number one, we found that, so they did research where they were actually looking at the coronary arteries of kids, and what they were finding is that heart disease can start as early as age 10 and 11 with something called a fatty streak, and that's just the very first physical sign that we have that not just about high cholesterol, but actual heart disease, that cholesterol is then forming into clumps and sticking to the walls that then can cause heart attacks, strokes, peripheral vascular disease, kidney failure, things of that nature. So it begins way early. So does that mean then that there's nothing you can do? Oh well, I started when I was 11. No, absolutely not. What we find is that, again, a healthy diet, a plant-based diet can actually reverse heart disease. Cardiologists have done catheterizations where they actually go in there, throw dye in the coronary arteries, and repeat these tests after they've changed their diet and lifestyle, and they're actually finding that they can reverse it with just changing what they're eating. Food is so important because it's a source of antioxidants. It's a way to charge the body, it's giving the body the fuel that it needs in order to heal itself. And cardiovascular disease is just one example of that. Oh, and so yes, it can be prevented. Number two, it can be, you do not have to be 50 in order to get it. And women are now equal opportunity patients for heart disease. So we are equal in all of those levels, if not exceeding. 1 out of 3 women will have a heart attack or pass from a cardiovascular related event in the next year.
All right, great information. Thank you for sharing that. I didn't know that. All right, number 3. So cranberry juice cures urinary tract infection.
So this is extremely common. There are research studies that show that cranberry juice can help decrease the ability of bacteria in the bladder to adhere to the walls, and so it can help with prevention However, you still need an antibiotic. If you have a UTI, urinary tract infection, we do recommend that you take antibiotics. The cranberry juice can help to speed the process along, but it is not the cure-all for an actual urinary tract infection.
All right, so you hear that? You need to get antibiotics.
Please
not
get
just
your antibiotics.
Not just
Yes.
cranberries, okay?
Yes.
Cranberry juice.
Yes, or cranberry supplements even for that matter.
Yes. Now I'm sure there's a lot of women out there dealing with menopause, right? So menopause, does it cause weight gain?
Technically, no.
Okay.
Now, menopause itself, which is the change and the fluctuation of hormones in women around age 50, that does not cause weight gain. Women tend to gain 1 to 2 pounds every year if everything is left the same. So the standard is actually to gain weight, unfortunately. But other symptoms associated with that same time period, whether it be stress, decreased sleep, lack of exercise, poor nutrition, those things that can also be happening, then magnify that weight gain, and so we see it there. But menopause itself is not the cause of weight gain.
All right, ladies, so you heard it from the doc. You cannot say, because I'm going through menopause, that is the reason why I'm gaining weight, right?
There are lots of things we can still do.
We can still do and contribute. So let's make sure that we take care of that. All right, our last myth. It is harder to get pregnant after the age of 35.
So I'm not sure if this is a good or a bad thing, but the answer is no. There are plenty of women who are getting pregnant over the age of 35 without trying, without having to do in vitro, without having to do other clonal therapies and whatnot. There are, of course, not to take away from those who are having difficulty, but it's not due to age alone. So there are other factors that can contribute to infertility or having difficulty or having to work extra hard, I guess, at trying to conceive, but age is not, by itself, is not. Women
are waiting until a little bit later to get in their careers and just establish before they're having, children. So, I mean, there is definitely hope. You don't have to hurry up and try to rush and have a baby.
That's right. You don't
feel
have
like
to be
you're in the right place and kind of settle before you have their kids.
Absolutely,
Well,
absolutely. Never fear.
Yes, well, I appreciate you sharing those myths so we don't have to go on Google. We now have information. Join us every Tuesday. We'll be live, Facebook Live, or join us at a special location for Let's Talk Health so that you can become empowered about your health. Thanks again for joining us.
Thank you.